Hello everyone, welcome to my channel biomed at prachi. Guys, today we will talk on very common subject, that is ECG machine. In this video, I will explain how ECG signals are picked from body and the meaning of waveform. And most important, I am going to show you ideal placement of the leads. So please stick to video till the end. And I want to tell you that thank you so much all of my viewers. We have completed 1000 subscribers recently. So if not subscribed yet, before starting, please subscribe to our channel biomed at prachi and don't forget to hit the bell icon for upcoming notifications. So friends, long form of ECG is echocardiography. In short, recording of heart's electrical activity. Now you will think how it is called electrical activity. Yes, electrical. Everything that moves creates a potential or voltage, and our heart beats continuously from the time when we were in the mother's womb. So, this continuously moving heart creates one particular pattern of electrical activity which runs with our heartbeat rhythm. So, let's see how heart rhythms. At every beat, heart is depolarized to trigger its contraction. The SA node is the heart's natural pacemaker. From SA node, wave of depolarization spreads across the atria to the AV node, that is atrioventricular node. The impulse is delayed at the AV node and atrial contraction is completed. The wave of depolarization is then proceeds rapidly to the bundle of His, where it splits into two pathways and travel along the right and left bundle branches. The impulse travels the length of the bundles along the intraventricular septum to the base of the heart, where the bundles divides into the Purkinje fibers. From here, wave of depolarization is distributed to the ventricular walls and initiates ventricular contraction and contraction process of heart completed. This whole process creates electrical activity. When electrical activity is transmitted through the body, it can be picked up on the skin using electrodes on the skin. ECG machine processes the signals picked up by leads attached to the skin and produces a graphic representation of electrical activity of the heart. Normal ECG waveform is like this. Now, electrical activity towards the leads causes upward deflection. Electrical activity away from the lead causes a downward deflection. Depolarization and repolarization graph reflects in opposite direction. Standard ECG uses 10 lead cable to obtain 12 electrical views of heart, 4 on the limbs and 6 on the chest area as shown in picture. Three bipolar leads are lead 1, lead 2 and lead 3. This reflects difference between two of the three limb electrodes. Lead 1 consists of right arm and left arm. Lead 2 consists of right arm and left leg. Lead 3 consists of left leg and left arm. And right leg is always neutral. So the three leads are AVR lead, that is right arm, AVL lead, that is left arm, AVF lead is left leg. These are called unipolar leads and are also named as augmented leads. Another 6 electrodes placed in standard position on the chest wall gives rise to 6 unipolar leads known as precordial leads and are from V1 to V6. Limb leads are named as RA, LA, RL and LL. Are color coded to avoid misplacement. Red is for right arm, green is for left leg, yellow for left arm and black for right leg, which is neutral. As shown in image, chest lead attachment is in this way. V1 and V2 are on either side of the sternum on the fourth rib, V4 on the apex of the heart, V3 halfway between V2 and V4, V5 and V6 are horizontally laterally from the V4. This is done with the ideal placement of the electrodes. Now we will see how graph is formed according to heart activity. You can see ECG waveform in given picture and the segments of waveform. One by one we will understand. First is P wave. P wave is small deflection wave that represents atrial depolarization. PR interval, it is the time between the first deflection of the P wave and the first deflection of the QRS complex. And third is QRS complex. Three waves of the QRS complex represents ventricular depolarization. In that, small Q wave corresponds to depolarization of intraventricular septum. R wave reflects depolarization of main mass of the ventricles, hence it is the largest wave, and S wave signifies the final depolarization of the ventricles at the base of the heart. ST segment is the time between the end of the QRS complex and the start of the T wave. T wave represents ventricular repolarization. Atrial repolarization is also there, but it gets obscured by the large QRS complex. In this way, ideal ECG waveform gets formed. Any abnormality or ups and down in this waveform clearly indicates problem in heart rhythm or heart function. So all of you take care of your heart and its rhythm. Thank you so much for watching till the end. In next video, we will learn something new. Till that, keep learning, do your best. Bye bye.